Hello students, today we will have lecture on antigen. So now we will see definition of antigen. So antigen is defined as any substance that satisfies two immunological properties, that is immunogenicity and antigenicity. So what is immunogenicity? It is ability of antigen to induce immune response in body. And what is antigenicity? It is ability of antigen to combine specifically with antibodies or T cell surface receptors. Then we will see epitope. So what is epitope? It is smallest unit of antigenicity. It is also called as antigenic determinant. And there are two types of antigenic determinants. One is sequential or it is linear and it is mostly seen in T cells. And second is conformational or non-sequential epitope. So it is mainly associated with the B cells. Types of antigen. So there are two types, complete antigen and incomplete antigen. So complete antigen, when it induces antibody formation, it is called as complete antigen. And incomplete antigen is also called as hapten. So it is incapable of induction of antibody formation. Now we will see incomplete antigen, that is hapten. So definition is they are low molecular weight molecules that lack immunogenicity but retain antigenicity. So there are two types again. One is simple hapten and second is complex hapten. So simple hapten is univalent, contain only one epitope, that is antigenic determinant, and complex hapten, it contains two or more epitopes, and haptens can become immunogenic when combined with larger protein molecule called carrier. Means they can produce antibody when they combine with the other protein molecules. Now we will see antigen-host relationship. So it is self or autoantigen, so belong to host itself. So that is that antigen is present inside the host body. Then non-self, or it is also called as foreign antigen. That means it is present outside the host body. Then they are again of another different types. So first is alloantigen. So it is species specific antigens are called as alloantigen. This is when the antigens present in a species. Then isoantigen, present only in subset of species. Example, blood group antigen, histocompatibility antigen. So they are called as isoantigen. Then heteroantigen. So antigens belong to two different species. Example, heterophile antigen. Now we will see in detail about heterophile antigen. So what is definition? It is type of heteroantigen that exists in unrelated species, that is different species. Antibody produced against antigen of one species can react with other. So the mechanism is used as a diagnostic application in few tests. So example of that is first is Will-Felix reaction. So it is used for the diagnosis of typhus fever. So in that antibodies against rickettsial antigen are detected by using cross-reacting protease antigens. Then second test is Paul-Bunel test. This is used for the diagnosis of infectious mononucleosis. So in these antibodies against Epstein-Barr virus, which is causing infectious mononucleosis disease, so these Epstein-Barr virus antigen are detected by using cross-reacting sheep RBC antigens. So these are two examples of heterophile antigen. Now we will see determinants of antigenicity. So what is antigenicity? We already saw it is property that makes substance antigenic. That means it combines with specifically with the antibodies. So there are factors depending on that the substance can become antigenic. So first is size. So large molecular weight, they are highly antigenic, and low molecular weight substances, they are less antigenic. Then second is a chemical nature. So proteins, polysaccharides, they are highly antigenic, and lipids, nucleic acid, they are less antigenic. Then third factor is a foreignness to host. So it is non-self. So they are immunogenic. Self, mostly they are not immunogenic. Then genetic factors. Then next is the optimal dose of antigen. Then next is the route of administration of antigen. So orally if you give antigen, then there is production of IgA antibody. In inhalation usually there is production of IgE antibody, and parenteral, that is intramuscular or IV, it is production of the IgG antibody. Then site of injection. So hepatitis B injection should be given in deltoid region because gluteal fat is there, and in that absence of APC means antigen processing cells are absent in that. So hepatitis B injection should be given in deltoid region. So site of injection is important factor. Then repeated dose of antigen. So they increase immune response. Then multiple antigens. So immune response is increased. In that adjuvant like action is there. Example of that is DPT vaccination. So in that pertussis act as an adjuvant. Then effect of prior administration of antibodies. So immune response is decreased. So example of that is RH immunization. So in that, if the Rh antibodies, the Rh immunoglobulin is given, then Rh antibodies are not produced, and then that is used in the treatment of the or prevention of the hemolytic disease of newborn. Now we'll see biological classes of antigens. So there are two types mainly depending mechanism of inducing antibody formation. So first is T cell dependent antigen. It is also called as TD. An example, all normal antigens are TD or T cell dependent antigens. Then second is T cell independent antigen. So it is also called as TI. So example, bacterial capsule, flagella or LPS, that is lipopolysaccharide. They are T cell independent antigens. And third type is super antigen. Now we'll see super antigen in detail. So definition, they are protein molecules that activate very large number of T cells irrespective of their antigenic specificity, and then they can cause disease. So we'll see examples of the super antigen and disease. So first is Staphylococcus aureus. So it has that enterotoxin which acts as a super antigen, and then it gives rise to disease like food poisoning, toxic shock syndrome. Then second example is group A Streptococcus. In that pyrogenic exotoxin is a super antigen, and then it causes disease like rheumatic heart disease. Then third is Epstein-Barr virus. In that Epstein-Barr virus antigen acts as a super antigen, and then it causes disease like B-cell lymphoma. Now we'll see in short about sequestrated antigen. So what is the definition? So certain self antigens are present in closed system and are not accessible to immune apparatus and are called sequestrated antigens or hidden antigens. So that means they are present in the body but they are in hidden form. So when they get exposed, then they cause reaction and then disease. So they are called as sequestrated antigen. So examples of few sequestrated antigen is first is lens antigen of eye. So it is enclosed in a capsule. So but while doing cataract surgery, if antigen leaks and then it causes immune response and then damage the lens of other eye. Then second is a sperms. So they are in hidden form. But if mumps infection is there and then in that the leak of the sperms is there, then that causes immune response and then that causes orchitis, that is inflammation of the testes. Then third example is thyroglobulin. So it is present in hidden form, but antibody to thyroglobulin is formed, and then that can cause disease like thyrotoxicosis or Graves' disease.
Hello students, let's study antibodies, that is immunoglobulins. What is antibody? Antibody is produced in response to antigens and they react with the antigen. They are protein, also immunoglobulins, part of gamma fraction of serum, found in circulating in blood, plasma, lymph or mucus or fixed to cells or tissues, and it protects against bacteria, exotoxins and viruses. So they are proteins synthesized by host in response to exposure to foreign substances. All antibodies are proteins. Antibodies are gamma globulins or immunoglobulins are produced by B lymphocytes, beta lymphocytes, that is plasma cells, and response to antigens. The structure of antibodies. Antibodies are gamma globulins with molecular weight of 1,50,000. Two pairs of polypeptide chains are there, one pair of heavy chain, one pair of light chain. Two halves are held together by disulfide bonds. The light chain and a part of heavy chain form one arm and remaining part of heavy chain form another arm. The light chain contains kappa, that is corn gold or lambda lapari. two regions are there, constant region and variable region. So the variable region end forms the amino terminal, that is FAB, and it is attached with the antigen binding site. The end constant, that is CH, it is carboxy end, it is also called FC. The hinge region is junction between CH1 and CH2, and it is sensitive to enzymatic digestion. Types of antibody is according to H chain, and it is designated by Greek letter. So now first is IgG, the H chain is gamma; IgM, the H chain is mu; then IgA, the H chain is alpha; IgD, H chain is delta; IgE, H chain is epsilon. First immunoglobulin is IgG, which constitutes about 70 to 80% of total immunoglobulins of the body. It has maximum daily production and highest serum concentration. The function: IgG can cross placenta, hence provide immunity to fetus and newborn. It is complement fixing, phagocytosis. This IgG plays a major role in neutralization of toxins. It is raised after a long time following infection and represents chronic or past infection. IgA, it is dimeric in nature. It has two monomeric units joined by a J chain. Secretory component: the location of IgA is found in body secretions like milk, saliva, tears, intestinal and respiratory tract mucosal secretions. Function: local or mucosal immunity. It is effective against bacteria like Salmonella, Vibrio, Neisseria, and viruses like polio, influenza. Breast milk is rich in secretory IgA and provides good protection to immature infant gut. IgM, the highest molecular weight and pentameric in structure. It present is only in the intravascular compartment and not in body fluids or secretions. Function: it represents acute infection, fetal immunity, protection against intravascular organisms, and mediate agglutination. IgE, it has affinity for the surface of tissue cells, mainly mast cells of the same species. It is extravascular in distribution, mediator of type 1 hypersensitivity. IgE is elevated in helminthic infections. IgD is found in membrane immunoglobulin on the surface of B cells and act as B cell receptor along with IgM. No other function is known for IgD so far. Abnormal immunoglobulins. So Baines-Jones proteins is one of that. It is found in multiple myeloma. It has many increased light chains of immunoglobulins. The cryoglobinemia, formation of gel or precipitate on cooling the serum, which redissolves on warming. It is seen in myeloma and SLE.
Hello students, let's study antigen-antibody reaction. Antigen-antibody reactions in vitro are known as serological reactions. They help in diagnosis of infections, epidemiological surveys, identification of infectious and non-infectious antigens. Measurement of antigen and antibody titer or units. So antibody titer of a serum is the reciprocal of the highest dilution of serum, which shows an observable reaction with the antigen in the particular test. The important parameters are sensitivity and specificity. Sensitivity, ability of the test to detect even very minute quantities of antigen or antibody. So false negative results are absent or minimal. Specificity, ability of the test to detect reactions between antigen and its homologous antibody. So false positive reactions are absent or minimal. Murach's or lattice hypothesis. So it is zone phenomenon. Antigen-antibody reaction is weak or fail to occur when the number of antigen and antibodies are not proportionate to each other. So first is prozone phenomenon. In the earlier test tubes, antibodies are excess. Hence, antigen-antibody reaction does not occur. So it is antibody excess. Post-zone phenomenon: in the later test tubes, antigen is excess. Hence, the antigen-antibody reaction failed to occur. So post-zone is the antigen excess. So in prozone or post-zone, lattice does not enlarge due to inhibition of lattice formation by excess antibody or antigen respectively, as the valencies of the antibody and antigen respectively are fully satisfied. So in the zone of equivalence, there is the optimal proportion of antigen and antibody. So there is the lattice formation. Types of antigen antibody reactions. So conventional and near techniques. So in conventional techniques, it is precipitation, agglutination, complement fixation, and neutralization. In newer techniques, it is enzyme link immunosorbate assay, that is ELISA, enzyme link fluorescent assay, then immunofluorescence assay, radioimmunoassay, chemiluminescence linked immunoassay, that is CLIA, immunohistochemistry, rapid test, lateral flow, immunochromatographic test, flow through, then Western blot and immunoassays using the electron microscope. Precipitation reaction when a soluble antigen combines with its antibody in the presence of electrolyte sodium chloride at a suitable temperature and pH. The antigen antibody complex forms an insoluble precipitate is called precipitation reaction. So, and then precipitation in liquid medium forms the insoluble floccule is called flocculation. The application of this precipitation reaction, VDRL test for diagnosis of syphilis, RPR test for diagnosis of syphilis, Illich gel precipitation test for diphtheria toxin. Second, agglutination reaction when particulate antigen is mixed with its antibody in presence of electrolytes at a suitable temperature and pH. The particles are clumped. The agglutination is more sensitive than precipitation for detection of antibodies. Mechanism when antibody is added to suspension, it combines with surface antigens and links them together to form clearly visible aggregates. Types direct agglutination, so it is antigen detection, and in that it can be done by slide and tube method. So a slide example, Vidal test, and tube example, Vidal test for determining the titer. Indirect agglutination, detection of antibody, so passive uh, antibody detection, latex agglutination, example ASO, reverse passive antigen detection, latex agglutination method, example RACR. Hemoglobination, so RBC is used as an antigen. Example, pulmonary test for extreme virus detection, blood group use test. Third is a complement fixation test, and fourth is a neutralization test. So in that, toxin antitoxin neutralization is there. Example is the Nagler reaction used for detection of alpha toxin of the Clostridium perfringens. Precipitation reaction, we have already seen the definition. Precipitation in liquid medium, ring test in a narrow tube, example capillary tube, antigen solution is layered over the antiserum. Precipitate ring appears at the junction of two liquids, example streptococcal grouping by Lancefield technique. A SCOL is thermoprecipitation test for anthrax. Flocculation test when a drop of antigen is mixed with a drop of patient's serum, floccules appear, example VDR RPR. Tube flocculation can't test previously used for the syphilis. Precipitation in gel is also called immunodiffusion. Using 1% soft agarose gel for precipitation reaction, many advantages over the liquid medium. Results in formation of clearly visible bands instead of floccules that can be preserved for longer time. Can differentiate individual antigen from a mixture as each antigen forms a separate band. Principle whether only antigen diffuses, single diffusion, or both antigen antibody diffuse, double diffusion. Whether antigen or antibody diffuses in one dimension, that is vertical diffusion when test is done on tube layer with gel. Two-dimension diffusion in both x and y axis when test is done on slide or petri dish layered with the gel. Types of immunodiffusion in gel. So first is single diffusion in one dimension, Odin procedure. Double diffusion in one dimension or clay through procedure. Single diffusion in two dimension, radial immunodiffusion. Double diffusion in two dimension, Orther-Laning procedure. Example of two, this is Legges detecting toxin of Corynebacterium diphtheria. Agglutination reaction when particulate or insoluble antigen is mixed and then it forms the clumps. So in the types, first is direct agglutination. So in this antigen directly agglutinates with the antibody method, slide and tube method, and then uses a typhoid fever, Vidal test, acute brucellosis, standard agglutination test, Coombs agglutinin antiglobulin test, heterophile agglutination test, example typhus fever, that is Will-Felix reaction, infectious mononucleosis, pulmonary test, mycoplasma pneumonia, cold agglutination test. Indirect or passive agglutination test for antibody detection. Then examples are indirect hemagglutination test, latex agglutination test, and passive agglutination test where RBCs are used as a carrier molecule. Let's study serological tests like RACRP, SO, Vidal, VDRL.
Hello students, today we will see serological test. So first is RA test. So it is rheumatoid arthritis test. So clinical significance is RA test is done to detect presence of rheumatoid factor in patient of rheumatoid arthritis. So rheumatoid arthritis is a disease of the old age patients in that all the joints are major joints are involved. Procedure, in short, you have to take three circles, label it as test, positive control, negative control, add serum to test, then positive control 1 drop to PC and negative control 1 drop to MC, and then add antigen provided in the kit, mix and wait for 2 minutes and then see for the clumps. C-reactive protein CRP, it is also done same way. Take taste, positive control, negative control, and then add serum and then reagent and mix and wait for 2 minutes and see for the clumps. So C-reactive protein significance, it is mainly a inflammatory marker of inflammatory condition of infectious or non-infectious origin. So when the WC count is raised, ESR is raised, CRP is also positive. Antistreptolysin O titer, that is ASO test, it is done for the investigation of rheumatic fever. It is a post streptococcal disease. In that, antistreptolysin O titer is raised and procedure is same as RA and CRP. You do take three circles, taste positive control, negative control, add serum, PCNC and add reagent and then mix and wait for 2 minutes and see for clumps. Thank you. Hello students, today we will see serological test, that is Vidal test and VDRL test. So Vidal test is done for diagnosis of the typhoid fever and paratyphoid fever, that is caused by Salmonella typhi and paratyphi A and B. So in that, what is the principle? So in that, four antigens are there: O, H, AH and BH. So O is pink color, sorry, O is blue color and H, AH, BH are pink color reagents. So procedure by slide method, you have to add 1 drop of serum, 1 drop of positive control, 1 drop of negative control, and then you have to add, so the total 4 drops you have to take to add 4 antigens of the serum, and then add 1 drop of O, H, AH and BH antigen, mix and then wait for 1 minute and then see for the clumps. So if clumps come within 1 minute, then it is the positive test. So O and H for the typhoid fever, AH for the paratyphoid A fever, and BH if clumps are there, then it is for paratyphoid B fever. Then VDRL test, so it is venereal disease research laboratory test, method by slide method. Again you have to take 1 drop of serum, 1 drop of positive control, 1 drop of negative control, then add antigen to each one drop and then mix and rotate for 8 minutes on the VDRL rotator or by manually, and then see for the clumps. So here you will see floccules. So report can be done if no floccule seen, non-reactive; if weak floccule seen, weakly reactive; if strong floccule seen, it is strongly positive. And then significance, it is done for the diagnosis of the syphilis test, and syphilis is caused by Trypanosoma pallidum spirochetes. It is a sexually transmitted disease, and then it should be done usually in pregnancy to rule out congenital syphilis, because in that baby may get stillbirth, IUD or mental retardation. So that syphilis test is done. Thank you.
Hemogglutination test, where the RBCs are used as a source of antigen in agglutination test. Then application pollen test, cold agglutination test, blood glucose Coombs test for anti-globulin test. Coombs test or anti-globulin test is performed to diagnose Rh incompatibility by detecting Rh antibody from mother and baby serum. So in Rh incompatibility, Rh negative mother with Rh positive baby because of the Rh positive father, and then if the Rh antibodies are incomplete or blocking antibodies. So there are two types, direct and indirect. So in direct antiglobulin test, the Rh antigen is present on the RBCs and the other RBCs are antibody coated on fetal RBC. So antiglobulin added that is Klum's reagent, and then Rh antibody coated fetal RBCs get agglutinated. Indirect antiglobulin test, there are free antibodies, Rh antibodies in mother serum, and then reagent RBCs are there. When Klum's reagent added, the Rh antibody coated on reagent RBC gets agglutinated. Complement fixation test. So as the name detects antibodies in patient serum that are capable of fixing with the complements. It was very popular, but now it is obsolete. Application Wassermann test was also widely used for detection of complement fixing antibodies in rickettsia, chlamydia, brucella, mycoplasma infection, and some viral infections such as arbovirus rabies. Complements are also used for various serological tests other than CFT, like Treponema pallidum immobilization test, Sabin Feldman dye test for toxoplasma, and Vibrio antibody test. Neutralization tests nowadays most not commonly used. Various examples: virus neutralization test, plaque inhibition test, toxin antitoxin neutralization test. Examples: shake test, Nagler reaction, ASO test, hemagglutination inhibition test. Antibodies in patient sera can agglutinate with the hemagglutinin antigens present on surface of some viruses. Was used in past for diagnosis of various viral diseases. Example: influenza. Newer techniques. The first one is the ELISA, enzyme link immunosorbent assay. So principal antigen antibody complex attached with the enzyme plus substrate activates chromosomes, and then color changes there, and that is detected by ELISA reader. Enzyme is the peroxidase, immunosorbent is a polystyrene or polyvinyl material, substrate is the hydrogen peroxide. Types of ELISA: direct ELISA to detect antigen, indirect ELISA to detect antibody, sandwich ELISA to detect antigen, competitive ELISA to detect antigen. Application: sensitive test to detect antigen antibody reaction for HIV, hepatitis A antigen, hepatitis B, E antigen, HCV, NS1 dengue antigen, Epstein-Barr virus antigen, HSV toxoplasma. Advantages: test is specific, sensitive, large number of samples tested at one, mostly used in the blood for the screening of the donors. Disadvantages: costly. Enzyme link fluorescence assay, modification of ELISA. So it is automated system, and antigen antibody complex is detected by fluorometric system. Application: markers of hepatitis viruses, HIV, antibody to torch, measles, mumps, rotavirus, and H. pylori. Immunofluorescence assay. Fluorescence refers to absorbing high energy short wavelength ultraviolet light rays by the fluorescent compounds and in turn emitting visible light rays with low energy, longer wavelength. Fluorescent dye is used to conjugate the antibody, and such labeled antibody can be used to detect the antigen or antigen antibody complex on the cell surface. Types: direct, indirect flow cytometry. Flow cytometry is laser-based technology that quantitatively analyzes and separates the cells as they pass through the laser beam. Application: detection of autoantibodies, antinuclear antibody in autoimmune diseases, detecting microbial antigen, the example rabies antigen in corneal smear, then detection of viral antigen in cell line inoculated with the specimen, flow cytometry, CD4 count in the HIV infected patient, detection of leukocyte with specific marker for diagnosis of various lymphomas. Chemiluminescence linked immunoassay, that is clear. Emission of light as a result of chemical reaction. Light is detected by luminometer. The application: detection of antigen, antibodies, hepatitis viruses, HIV, and torch. Immunohistochemistry to detect antigen in cells of tissue section by using labeled antibody. Diagnosis of tumor cells. Western blot detects specific proteins or antibodies in a sample containing mixture of antibodies each targeted against different antigens of same microbe. Procedure: so first SDS page separation of antigen fragments, then nitrocellulose membrane plotting, and third is the enzyme immunoassay. So used as a supplementary test to confirm HIV, Lyme disease, HSV, and toxoplasma. Rapid test immunochromatography, lateral flow assay, colloidal gold is used for labeling antibody. Application: hepatitis surface antigen, dengue test, rapid malaria antigen test. flow through assay. Protein A is used as labeling antibody. Example, Tridot, HIV and HCV. Montoux test in vitro detection of sensitization by Mycobacterium tuberculosis. Montoux test is performed by intradermally injecting 0.1 ml of tuberculin PPD of tuberculin by tuberculin syringe. For single dose test, 5 TU is used. Uses the diagnosis of suspected infection by Mycobacterium tuberculosis in young children as a post-vaccine check for the efficacy of BCG vaccination. Enzyme link immunosorbent assay. So there are two types, homogeneous and heterogeneous. So in homogeneous, all regions are added at one step and then used for detection of haptens like drugs. And then heterogeneous, so named because of two components, immunosorbent and enzyme. And there is substrate enzyme, the chromogen system added to the final step of ELISA. ELISA principle, antigen antibody complex, enzyme, then substrate is added which activates the chromogen and there is color change detected by spectrophotometry. And here you can see ELISA reader, ELISA washer and automated ELISA machine by BioRad. ELISA is performed on microtetraplate containing 96 wells, micro ELISA, and sometimes in tubes, that is macro ELISA. So microtetraplate or tubes are made up of polystyrene or polyvinyl by polycarbonate material. ELISA kits are commercially available and then procedure involves a series of steps done sequentially and each step reagent is being added, incubated and followed by the washing. Types of ELISA: direct, indirect, sandwich, competitive, and ELISpot. Direct ELISA used for detection of antigen in test serum. Primary antibody targeted against serum antigen is labeled with the enzyme. Step 1, well of microtetraplate are empty, not pre-coated with the antigen or antibody. Step 2, test serum containing antigen is added into the wells. Antigen becomes attached to the solid phase by passive adsorption. Step 3, after washing, the enzyme labeled primary antibody raised in rabbits are added. Step 4, after washing, substrate chromogen system is added and the color is measured. Indirect ELISA, antibody detection. So solid phase of wells of the microtetraplates are pre-coated with antigen. Wells are coated with antigen plus primary antibody, that is test serum, plus secondary antibody labeled with enzyme plus substrate chromogen development of color. Indirect ELISA, antigen detection. Wells are empty, not pre-coated. Antigen, that is says serum added, gets adsorbed to well plus primary antibody plus secondary antibody enzyme labeled. Then substrate chromosome development of color. Advantages of ELISA. So it is method of choice for detection of antigen antibody. Sensitive, specific. Disadvantage. It is costly. Application. ELISA used for antigen detection. Hepatitis B surface antigen, pre-core antigen, that is HBe antigen, NS1 antigen for dengue. ELISA can also be used for antibody detection like hepatitis B, hepatitis C, HIV, dengue, EBV, HSV, toxoplasma, leishmania. Enzyme link fluorescence assay. So it is modification of ELISA because it is fully automated system. All steps are performed by instrument. Antigen antibody complex. Antigen antibody enzyme complex is detected by fluorometric method. VIDAS and mini VIDAS are the systems available. Advantage: automated system to perform easy, user friendly, less contamination, give quantitative results, more sensitive and specific. Disadvantage: expensive. Application: infectious diseases, biomarkers like procalcitonin hormones, tumor markers, cardiac markers, screening of allergy. Immunofluorescence assay, similar to ELISA. The difference is fluorescent dye is used for the labeling of antibody and detects cell surface antigen or antibodies bound to cell surface antigen. Then it is absorbing high energy short wavelength ultraviolet light rays by fluorescent compounds and in turn emitting visible light rays of low energy longer wavelength. And then types are direct, indirect. Application: detection of autoantibodies, rabies antigen and viral antigens on cell lines. Flow cytometry, laser-based technology that quantitatively analyzes and separates the cells as they pass through the laser beam. And then application is CD40 cell count in HIV infected and leukocyte antigen or markers on the lymphoma. Western blot, it is the detects specific proteins in sample containing mixture of antibodies. Southern blot detects DNA fragments. Northern blot detects mRNA. Eastern blot detects carbohydrate epitopes on proteins or lipids. Application supplemental test for the HIV. Rapid test, a point of care test. There are two types: lateral flow through. Immunochromatography, that is lateral flow assay. So the test system consists of nitrocellulose membrane and absorbent pad. Two formats available: cassette and strip. Application: hepatitis B surface antigen. Second method in ICT is the flow through assay. So protein A is used for labeling antibody. In lateral flow, it is gold conjugate. So sample flows vertically through the nitrocellulose membrane, and then example can be antibodies to HIV. This chart is a summary of the newer techniques. So ELISA, in that color change is detected by spectrophotometer, then enzyme linked fluorescence assay, fluorometry detection, immunofluorescence assay emits light and detected by fluorescence microscope, radioimmunoassay emits beta and gamma radiation and detected by counter, chemiluminescence linked immunoassay emits light detected by luminometer, immunohistochemistry, color change naked eye or fluorescence microscope, Western blot, color band, immunochromatography, that is from lateral flow and flow through color band measured by naked eye.
Hope you find this session useful for your understanding and for your exams. Thank you.